I happen to be president of the board of directors of the Block Island Medical Center, and we've had a terrible time recruiting physicians. It's an isolated island, and it's expensive, and we don't offer the same kind of benefits. Benefits, yes, but not salaries that they can earn elsewhere. And so we've been looking at affiliating with a mainland organization. And I took a trip with another board member last week to Thunder Mist in Woonsocket. And I was really impressed with what they're doing. And I think that much of what they're doing is a direct reflection of Obamacare, as they call it, where government is really investing in technology and in healthcare delivery. And what can we do to advertise that? Because you hear over and over again that this isn't working. It's ridiculous for the government to be involved with healthcare, but they are demonstrating real success. And I think we need to be promoting that, not only in Rhode Island, but nationally.
Well, Pam, I agree with you entirely, and also let me congratulate you on the 350th anniversary of Block Island. I'll be there next Saturday to celebrate with you. And let me thank you for your service on the Block Island Medical Center. That is incredibly important. Let me deal with the two issues you raised. First, once again, I concur. I think this notion of cutting benefits for Medicare, cutting back on Social Security to plug deficit holes doesn't make as much sense as doing what we did in the 90s, that is, raising revenue, particularly from the wealthiest Americans, and then going in and cutting programs that are not central and vital. And those programs include a whole range, including some defense programs, which the Republicans believe are sacrosanct. I think we have to look at every program. And not only when we have new revenues can we begin to think seriously about preserving Medicare, Medicaid, and Social Security, but there are other concerns in terms of long-term economic vitality of the country. Good education reform, support of infrastructure so that we can be economically viable. All those things, as well as Medicare and Medicaid, are sacrificed, in my view, by the insistence that we make not just maintain the income tax cuts for the wealthiest, but in fact do more of those things. So I'm supportive of your point. I think it's the right in terms of not only it's the right thing in terms of how to deal with the deficit. The second issue you raise is also one that is very insightful. That is the tremendous and increasingly important role that community health care centers are playing as a result of the Health Care Reform Act last year. We pledged an additional billions of dollars of real investment into better information technology, into better coordination, into more active preventive care. And the community health care centers are doing a remarkable job. Thunder Mist is just one of them. This week, last Friday, I visited a collaboration between the Providence Center, which is a mental health organization, and the Providence Community Health Center. They are co-locating. They are beginning to integrate their records and their delivery through preventive care, through better monitoring of patients. They're going to be saving money as well as reaching more patients. Those are some of the things we can do smartly to begin not to shift cost of health care to seniors, but to begin to bend the proverbial health cost curve. The other point I would make, and you've raised it, that is the difficulty of attracting qualified physicians in some cases to Rhode Island and other parts of the country. And that goes back to a rather complicated and in some respects out-of-date compensation system that evolved in the 1960s under Medicare. We've been trying for years, and not just myself, but my predecessors, Senator Chafee, John Chafee, Lincoln, Pell, we've all been trying to make that system more effective. We have to do much more.